Hello, Patrick.
Good morning. Who's on the line? Is that Diane? Chelsea?
Yep, we have quite a few people coming on now.
Great. Get my volume up.
It looks like we have one, two, three of the speakers so far.
3 of the 7, huh? Okay. Well, I think we can.
Well, there's a couple organizations you'll see, Patrick, that have two people speaking for their organization.
Yeah, and I see we changed somebody from the Bart Clinic as well, so that's fine.
Yeah, I fixed Tammy's name on the Somerset Counseling one because her last name is different. So,
Okay.
yeah.
Okay.
So it looks like we are.
Great. Should be a good session. I'm looking forward to hearing from all these organizations.
There's another one, so we're getting there. Chelsea, are you gonna do the slides for me?
Yes.
Thank you.
You bet.
Well, good morning, everyone. This is Patrick Jones, your facilitator for today's meeting, calling you from cloudy Spokane, and we got a couple minutes before the hour. So as is our habit, we'll wait for more people to show up and start probably a couple minutes after the hour. So stay tuned and we'll get going shortly.
Patrick, it looks like we have everybody but David.
Wonderful. So David Bauman hasn't come onto the line yet. Well, I think we'll get started, everyone. It's a couple of minutes after the hour and we've got a full agenda. We've got actually 7 presentations, which is a lot for a Leadership Council meeting. So we like to give everybody an opportunity to give their presentation and take questions. As you see on the agenda on your screen, we do have a bit of time for that at the end of the meeting. I just want to tee this meeting up by saying that in principle, we at the Greater Columbia ACH have always thought that it's important to get feedback at a interval that's not too far down the road to see how the programs that the ACH is funding, how they're doing, and what lessons have been learned so far, and what mid-course changes have taken place, and what the outlook for the near term looks like. And so that's what we're going to do today, as you can see, with behavioral health, and in particular, the workforce element of behavioral health. It's become clear to, I think, anybody who looks at healthcare reform that one of the key elements and one of the key constraints of looking at producing the triple aim in a little bit better fashion is workforce. And that workforce needs is probably most acute in our region in the state in the area of behavioral health. And so as a result, the board has authorized over a year and a half ago, I think, monies to be spent on developing that as best we can, future workforce. And as you, I hope, read in your invitation to today's meeting, that was to the tune of $850,000 with 19 organizations and 50 different intern slots funded. So for the ACH, that's a pretty big bite in workforce development. And we thought it was only appropriate then to check back in with some of those participants in the program and see what we can all learn. So that will be the substance of today's meeting. We'll take a short break halfway through the reports out, and then we'll wrap up with any just general discussion. And I hope that we'll have an opportunity after each presentation, will depend on the length of the presentation, of course, to have one question or two if you so desire. So as we like to start now, we'd like to put up the, yes, there you have it, Chelsea, thank you. Please stick around to take the short survey. That feedback is helpful to our current and future planning for these kinds of meetings. So now, Chelsea, if we can go to the land acknowledgement slide, and as has been our custom for a while, if there's anybody online who would just like to take a moment and read that purple box out loud, starting with "it is." Would anybody like to say something to that? Would anybody like to basically give us their rendition of this particular land acknowledgement?
This is Brittany. I can read that.
Okay, Brittany, thank you.
It is the historic homelands of the 14 confederated tribes and bands of the Yakima people. The Yakima people remain committed stewards of this land, cherishing it and protecting it as instructed by elders through generations. We are honored and grateful to be here today on their traditional lands. We give thanks to the legacy of the original people, their lives, and their descendants.
Thank you, Brittany, so much. All right, I think we're ready to get an overview of the program from Carol. So Carol, the floor is yours.
Thank you, Patrick, and thank you for your overview. I think that you covered a lot of this material already. But way back in 2019, and I give credit to Dan Ferguson, who is a workforce expert and represents Greater Columbia ACH as the workforce guru. I think without his encouragement, Greater Columbia would not be as far along with their workforce efforts as they are. So I just wanted to give kudos to Dan. So we looked at the needs of our community with regard to the healthcare capacity of our delivery system. And we noted that we lacked behavioral health providers. This region has typically been and historically been deficient in having enough mental health penetration and behavioral health penetration. So what we had discovered through this process was there were a lot of organizations that were getting calls to precept students towards their behavioral health programs, but they just didn't have the capacity to absorb those students. So Greater Columbia decided to go upstream from that and offer a program that would pay organizations that were willing to precept, supervisor, train professionals in careers in behavioral health, or that had a behavioral health component that needed clinical experience in order to complete their education and certification requirements. So we launched this program. We weren't sure what we were going to get back, but we got back lots of requests for this kind of a program, over $1.7 million in requests. We had set aside around $460,000, $480,000. So we went back to the board of directors and said, there is a great need for this program. They funded it to the tune of $850,000. We had an application process and winnowed down the 22 applications to 19 and started the program then in April of 2020 with the thought that it would be like a one-year program. Then COVID hit, disrupting everything. So we extended to those organizations that hadn't finished their preceptor program until June of next year. So 9 organizations received those extensions to June of 2022, but we did have 10 organizations that finished their programs, and we're going to be hearing from, I think, 8 of them today. So the outcomes of the organizations that completed the program, you can see here, 27 interns that had various certificates or licensure requirements for substance use disorder professionals or SUDP, substance use disorder professionals in training, PsychDs, some were pursuing their PhDs, 7 were working on their Masters of Social Work, and 1 intern was working on the Recovery Practice Certificate. So we have a smattering of hearing from some of those organizations today, and we're really excited to hear what they learned and lessons learned, because I think Greater Columbia will have another opportunity in the very near future to offer up this preceptorship program again. Thank you, Patrick.
Okay, yeah, I was going to say maybe there might be time for quick questions now, but on the other hand, perhaps we should hold those questions for the speakers. And at the end of the meeting, if you have questions for Carol, that might be the best time, unless there's something really urgent that needs to be brought out. Okay, then let's hear from the BART Clinic and Lindsay Underwood. I can't say we met, but we'll meet you now. And there's your bio for everyone to read. And we look forward to hearing how this has worked as a preceptor on your end, as an intern on the other side of the table over the last few months. So Lindsay, the floor is yours.
Hi, I am Lindsay from Barth Clinic. I am the practice transformation lead for Barth Clinic, and I have been involved with practice transformation with Barth from the start. I brought Alyssa Calhoun with me today. She is our clinical supervisor and one of the preceptors, just in case we needed her for any questions. We were very excited to be a part of the internship preceptor program. We hired several interns during that time, with Alyssa and Dale being our preceptors. We identified a lot of areas of training that we wanted to spend extra time to, specifically NADAC trainings and HIPAA compliance. Being a small clinic, we don't necessarily have the funds that others have to always offer a competitive salary. The internship fund allowed us to train and retain one of our SUDPs, which was a really big deal for us at the time because he is great, and we were able to keep him due to the funds. We had 2 other SUDPTs who were involved in the training specifically. one's become a highly capable SCDPT, and we look forward to watching her. We were able to spend a lot of one-on-one time and training into her and teaching her the ways of birth clinic specifically. We also had one intern that didn't work out and another that is still in training. For us, we truly believe that the internship offered us the ability to hire people that could have possibly gone elsewhere. We were able to start paying credentialing fees, assisting with college fees, offering a higher beginning wage, and offer the competitive salary I mentioned above. We were able to give our current SCDPTs that were also on site raise and attend extra trainings. So all in all, for us, we found the internship fund to be a very important asset to Birth Clinic, and we look forward to keeping our trainings like this in the future. That's pretty much it for me.
That's it?
Yes, sir.
Short and sweet, Lindsay. So I'll just pose one question, if others, because we have time now for about 5 minutes of questions. So what were the biggest challenges you faced in onboarding these interns at the BART Clinic?
I think for us, the hardest part was first of all, finding people that were wanting to become interns. You know, there isn't, it was a difficult process just getting people that wanted to be in the field, you know, so we had to kind of do some hunting, go through the program at YBC and look for people. So I think for us, that was like the hardest part, was actually obtaining the people that we needed to fulfill this program.
Thank you. So questions for Lindsay from anybody online about the BART Clinic's experience with preceptors and interns in behavioral health.
Oh, no, I don't know. I don't need anybody, definitely. I was just trying to get an idea of like, do you have 2 hours every single week, or do you have, 2 to 4 hours sometimes?
For each person, I'm going to hand you off to Alyssa.
Hi, I'm Alyssa, the clinical supervisor here at Barth.
Okay, that's what I was trying to figure out. So that's perfect. Thank you.
So we really expanded upon a program that we already had in place as far as counselor development. And yes, we've been able to expand our hours, having more people in the office. We're a very small clinic, and we don't have as many counselors running around here as maybe some of the other clinics in town. And so definitely being able to hire new trainees, we were able to expand our hours. I have it on mine and the trainees scheduled 2 hours a week to meet individually. And then we had a weekly staff meeting where we go over, patients of concern, things like that. But we've also created another training for another 2 hours every week where we go over counselor development trainings, other trainings, things that, I'm looking over in files and I think that we need to discuss or, go over as a clinic. And so we definitely just have more time. And also being a clinical supervisor, I'm sure you guys know that you might wear a lot of hats as far as doing groups and assessments. And so this has really allowed me to kind of step away from those responsibilities and spend more one-on-one time with my counselors in training. So it's been very helpful. Does that answer your question?
And this is Amy with Walla Walla. I was wondering, so you said that you have difficulty, recruiting folks, that you got people through this that might have gone elsewhere. What are your barriers? I would guess they're similar to down here, but I'd like to hear.
I think that one of the biggest barriers for us is just lack of people looking for a job. Throughout this whole COVID time, what we found is that a lot of people weren't trying to work as much as they once were. We used to have people coming constantly looking for a job, and we were basically, instead of them beating down the doors to look for a job, we were beating down other people's doors. So we were, going on Indeed, going on pretty much every job site, going to the schools, so I think for us, that was probably one of the biggest barriers. And plus also not offering the same hiring wage that other companies can. that definitely plays a part in it. You have to have a love for the addict and a desire to work in a smaller place if you're not going to get the same wage that you would going somewhere else.
But just
Thank
to
you.
clarify, sorry, and this is Dan Ferguson, and were you able to pay your trainees?
Oh, yes.
Okay. And I think, so thinking back about 2 years ago and thinking back to today, are there like 1 or 2 nuggets that you just, as far as what are some of the key changes or change the deliverables that you were able to offer because of this grant?
I would say it's the time. As I'm sure you know.
Oh, thank you. That's super helpful.
Yeah, I think that, you know, we're very busy. And I think that being
I don't want you
new people on board at Barth Clinic has enabled us to give, not only for me to give our trainees more one-on-one time, but also our patients more one-on-one time. Because the less counselors you have, the less, you know, the fewer number of patients we're able to see and the higher of the workload that we have. And so by us being able to really take the time to train, you know, quality counselors and build their competency, and for us to be able to have more one-on-one time with our patients has been definitely the greatest, the biggest things that we've been able to notice. And I definitely feel a lot of that stress taken off of me as a supervisor to be able to just really focus and train my counselors, you know, to the best of my and the clinic's ability. So I think that's definitely the best thing.
Okay,
Thank you. Appreciate it.
So we have time for one more question if people would like to ask our 2 on the line from the Barth Clinic about their experience. And
So Lindsay, did you guys say that you were able to retain one SUDPT or SUDP, or who was it that you retained?
So we were actually able to retain, we still have one who's an SUDPT still.
Okay.
And then we have an SUDP. He became an SUDP during that process. And he was actually approached by another Yakima company about going to work for them, which I can't really blame them. You know, we're shortage of staff around this area. And I know that he was really interested in that because they were offering more than what we were going to. So instead we were able to go above what they had offered, and he chose to stay here and continue on with us at Barth Clinic. And we were super lucky with this one because he is incredible. So
that's amazing. That's great. We're so happy to hear that. Yeah. Because I think maybe people aren't aware that SUDPs and SUDPTs have thousands of hours that they need to do a clinical experience, right? I think it's, you know, 2,000 or something. So it's really important that we have these programs in place to allow for these professions to blossom.
Yes, definitely.
Thank you.
Thanks, Carol.
okay, any final questions of Lindsay and others? Well, thank you, you two, so much for sharing. I hope you can stay on the line and hear what the experience has been among your colleagues scattered across the counties of the ACH.
Yes, sir. Thank you very much for having us.
Thank you.
All right. So now we're going from a relatively small opportunity or small clinic to one of the larger ones in the region, Community Health of Central Washington. And we're going to have David Bauman present. So David, are you up and ready for this?
I didn't see him on the line, so we may need to go and switch to the next.
Yeah, let's move on then if David's not quite ready. David, if you are on the line, we're going to try to get you then after this presentation from Pat Flores.
This is Stacy George from Community Health of Central Washington.
Yes,
and
are you
I'm
there,
following.
David?
I'm trying to find him. I think he's in clinic, so I'm sending him messages.
Well, why don't you do this, Stacy? We'll go on to the third presentation, and then we'll bring David on in about 10 minutes. How's that?
Perfect. Sounds good. Thank you.
Okay. So Pat Flores from Serenity Point Counseling Services. Are you ready to present? I like that name, by the way.
Oh, yeah, it's a good one, isn't it? Good morning, everybody. I'll start off by talking about what we did to implement our program. We actually took on 3 interns, different levels of education. And let's just start off with, we have a long history of working with Walla Walla University and doing practicum students, internships. But we have a lot of interest over here from the university. However, with that population, what tends to happen is that they are most of them are from out of the area or out of states. And so once they get their internship and their practicum completed, then they tend to move on. So what we did in this situation is that we were very selective in who we were seeking out. We were looking for local individuals that were interested in working on their SUDPs or MSWs. And then what we did with all 3 is we actually hired them as full-time employees with a full benefits package. Along with that, we drafted a employment agreement because we didn't want to put in all this effort into the training and then have them leave. So our employment agreement, we requested that they commit to a 2-year post-certification agreement, a commitment to working with Serenity Point. And also that they would agree to a 2-year non-compete. So if they finish their internship, at least for 2 years, they could not seek employment within a 50-mile radius. Also in the contract, we took a lot of the same language that passed it through from the ACH contract, and I added a lot of the same language that if they were unable to complete the program for whatever reason, that they would be required to pay back any monies that we had contributed to their internship. And so with that, we were able to find 3 different individuals. The first intern was a master's level intern, and with her, she needed only 1,500 hours of supervision. However, as they mentioned earlier, COVID definitely threw a wrench into everything that was going on. We had hard time finding online coursework for the coursework that all of our interns needed to acquire. And finally, all 3 interns were able to get involved with Eastern Washington University, which offers a lot of the SUD coursework. But during that time, although just the intern needed 1,500 hours, as of June, when we submitted our report, we actually had to provide about 2,248 hours of supervision, signing off on all her progress notes, her assessments, treatment plans, etc. Now, with this intern, the one thing that we learned is that the MSW program here in town, they lacked the pharmacology class. So that intern actually had to go through Eastern University and get this additional coursework completed. And she did complete and did take a test and completed her SUD testing on March 7th of this year. With our second intern, this intern was a Associate of Arts level intern. And with that internship, they're required to have 2,500 hours of supervision. As of June, we actually have provided 2,774 hours and still counting. And there again, a lot of it had to do with the inability to get involved in the coursework and then waiting for the courses that come up each quarter. This intern has recently completed, it's in the finishing stages of completing 20 credit hours of coursework that's required of the 45 hours to as far as studies for SUD certification. She has gone ahead and submitted her transcripts for review. And so we're waiting on decision from the Department of Health to ensure that her coursework satisfies what the requirements are. And so we're anticipating that she will be testing probably late fall of this year. And as the other two interns, she was hired full-time with a benefits package. And a lot of the funding that we use it to help her out with tuition cost. We sent them to ASAM training and for licensing, right? In order for them to get their SUBT certificates, we provided funding for that, paid for that. And then from that point on, any other certificates they need, we are reimbursing them for. And then our third intern is a bachelor's level psychology intern. In her, because of her level of education, she's required to have 2,000 hours of supervision. As of June 30th, we've provided 2,500 hours of supervision and counting. Now, in her case, she has been cleared by the Department of Health to take on her testing. And in some cases, what they do, they'll authorize the okay to do the tests pending the completion of their hours or their coursework. So in this case, she is waiting to go ahead and take the test when she completes her coursework, which is anticipated in winter of this year. One of the lessons learned with the psychology majors is that not much in comparison to the MSW student or intern, the required coursework is very limited. And so we found having her to take additional coursework in order to get up to the testing level. And her also, we went ahead and brought her on full-time with the benefits package. And all three have signed a contract with us to commit because, as you know, smaller agencies, especially out as we get more rural, it's pretty difficult to find people who want to come out and work in the middle of the wheat fields. And so that's why we took the direction of getting a contractual agreement into place, ran the information through our attorney to ensure that it was a fight that he was willing to take on. And so with his guidance, we think we came up with a pretty good contract agreement with all three interns. And that is it.
All right. Thank you. Is it Pat or Patrick?
Either way.
Either way. Okay. Thank you, Patrick. Questions for the Serenity Point experience with our internship preceptorship program? Anybody?
Hey, Pat, this is Dan Ferguson. Great to see you.
I can see you.
Did I hear you correctly saying that there was some challenges with some of the curricular issues with the university and having, so I guess I'm curious about how conversations went with them in regards to helping them think through adding courses or meeting some of the...
We haven't talked to them directly, but it was a barrier that the Department of Health came up with. Because there is a pharmacology course that is required that is not offered at the university. But aside from all the other coursework, like their group therapies coursework, individual, their counseling theory, that is all recognized by the Department of Health. But the one that we're lacking was pharmacology.
Okay, great, thanks.
Any further questions of Patrick Flores and the experience at Serenity Point?
Patrick, if these individuals had not entered this program, how long would it have taken them, or would you not have attracted them, or?
Yeah, well, there again, one of the, well, I should say, two of our interns, we actually were putting out job postings for. One of them was already employed as a mental health counselor, but was interested in getting the SUDP. And so, now, like I said, we were fortunate to find the local people. That's really the challenge, is finding people that got some roots here in the area. But it's always challenging. Like currently, we have some job postings out that have been running for about 6 months, and we've had to change our posting just to get a wider selection or a wider interest out there.
So it really would be safe to say that you were able to promote somebody because of this opportunity that possibly would not have been promoted, and you were actually able to draw in 2 more individuals who you may not have been able to attract without this program.
Yes, definitely.
Thank you.
Yeah, and it's cost us a lot more. I mean, we look at our interns as a major investment to not only the agency, but to the community. Like I said, it's real difficult to find people to move into the rural areas that have a qualified professional status. Yeah, it's not like the old days when I was going through internships where I had to come in and do my internship on my own time at, you know, without having a salary. So the funding definitely helps and contributes. It subsidizes a lot of what we're doing for our investments here.
Very good. Any more questions of Patrick? So here's one from another Patrick, from me. Did you have any pushback when you asked for non-compete clauses in your agreement with these folks?
No, because when we were interviewing, looking for the interest, they were made aware up front is what we would be looking for. So, yeah, the employee that we did have didn't have any problem with it. They had no plans of moving here out of the area. This is the field that they want to be. So, yeah, we didn't get any pushback on that.
Okay, all right. Anything else for our learning from Serenity Point's experience? That's what we're here for, is to pick these people's brains and see how it might work in our own particular shops in the 9 counties here. All right. Well, Patrick, thank you again.
Thank you all.
Hope you can stay in the line and participate in the general discussion later.
Okay.
Okay, so do we have David on the line from Community Health of Central Washington?
I am here. Yeah, I am here. Sorry about that. This is my 4th meeting that started at 6 a.m. this morning. So
oh my goodness,
being late here, but yes, I am on.
Okay, well, the floor is yours, David. If you'd like to just tell us a bit about your experience with Community Health in Central Washington with this program from RECH, and you've even got a PowerPoint, huh?
I do, and I was just going to ask, do you all want me to share, or are you all going to just click through these right now? What would be
Whatever
easier?
you prefer, David. I have it ready to go. If you just want to tell me to advance slide, I can do that, or I can quit sharing and you can share, whatever's easier.
You know, I can probably, it'd probably be easier just for me to go. And the other thing that I would say, for people that know me, I think there's some that are on the call, I can talk for days. So if I am talking too much, please be like, Dave, we got to move on. So
we have the hook here. Don't worry about that.
Okay. All right. Good deal. All right. So can people see my screen? Awesome. I just want to say from the beginning, thank you all so much for doing this, and not only the opportunity to apply and receive a grant from the community, and then also be able to present on the success that we've had this past year. My gratitude for it, because it really is something that with CHCW, Community Health of Central Washington, we have this mission statement of providing service and education. And this has allowed us to fill that mission in both domains pretty profoundly. So just to give some background, and people that might not know Community Health of Central Washington, we're located throughout Central Washington. We have 6 clinics. We have 2 family medicine full spectrum clinics, one of them in Yakima, one of them in Ellensburg, and they are both medical resident clinics. So we have a family medicine residency program. We have a pediatric clinic that's also located in Yakima. We have 2 rural clinics that are located in the communities of Natchez and Tieton. And then we also, which we're really excited about, we have a school-based health clinic at our Davis High School. And what's great is that due to the success of this program and allowing the funding, we have just got approved yesterday for adding a 3rd postdoc. And I think Stacy George is on, she'll be really excited about this. We added a 3rd postdoc for our school-based health clinic because we're expanding it pretty exponentially. So we're excited right now, indeed. So as I said, we have 2 family medicine residency programs. Our behavioral health program started around 2006. With us being a family medicine residency for almost 30 years, we've always had a behavioral health presence just because of the requirements of doing a behavioral scientist role there. But really in 2006, we started our integrated care efforts, and our training program for our interns and our fellows actually started in 2017. The funding that you all provided this past year, though, just really helped tremendously in our efforts and advocating to grow the program. We currently, in our program, have 6 psychologists, 5 master's level providers, and we have 3 doctoral interns that I'm going to talk mostly about today, and 2 doctoral fellows. Now, as I said, we're going to be next year at 3 doctoral fellows. So we're just really excited about that. Continue this moving. We have almost 400 employees that make up Community Health of Central Washington. We serve about 30,000 patients throughout the areas that we serve. Being a community health center, the majority of our patients are considered low income. We still, even through the efforts of the ACA and the state, we still have 5% of patients that are uninsured. 46% represent a race or an ethnicity other than white, and 11% of our patients require care in another language besides English. Okay, our training program overview. We have our internship and our fellowship is actually a partnership in a consortium through the National Psychology Training Consortium, which is actually based out of Missouri. The reason why we've done this is that anybody that knows about a American Psychological Association and accredited doctoral internship, the amount of work, the amount of money, the amount of administrative support you have to do, it literally renders community-based agencies almost impossible to do it on their own. I remember talking to our friends from Columbia Valley up in Wenatchee, and they have an APA accredited doctoral internship program that they did by themselves. And I still remember talking to their leadership, and they said, if you're starting this from the beginning, don't do it, just because of the amount of work, the amount of time, the amount of money that it was. So we were able to partner with a consortium to kind of really help with those costs and the distributing the administrative burden. So our consortium is actually made up of a partnership with Health Point Community Health Center, which is in the greater Seattle region, as well as Yakima Neighborhood Health Services, which is in Yakima, Washington. And then next year, we'll actually be partnering with Yakima Valley Farm Workers Clinic. So we're really excited just about the partnerships that we have within the communities and having this shared mission amongst our health centers of providing services to underinsured, low income, and populations that definitely have been largely left out of the behavioral health conversation. The other thing that I think it's really important to know is that we have a very unique training program, and we specifically focus on primary care behavioral health. People might be familiar with that. I think it's always good to just give a brief overview of what that means. We're training our interns and our future psychologists and behavioral health providers to be true generalists, meaning that they see all patients, any age, any condition, much like a family medicine provider would in primary care. We try to be as accessible as possible. So we sit in medical pods, we see patients in exam rooms, we do handoffs regularly throughout the day just to help with that accessibility piece. We're team oriented. We want to be part of the team. We try to embed ourselves into the clinic and be just like anybody else would be. We look and sound the same as a primary care provider and a medical assistant, a nurse, and support staff. We try to be highly productive because it's our social justice value of, the unfortunate reality in the United States that 8% of adults in the United States will have a contact with a mental health provider in an outpatient setting in this past year. I think that's ridiculous when we think about the need that's out there. So our goal is to have population-based principles to reach our community and the greatest extent and the highest penetration rate as possible. Try to be educators, not only to our patients, but to our entire system. And we want to be a routine part of care, that we want behavioral health integration within a primary care setting to be the expectation rather than the exception. We want to take behavioral health integration from a nicety to a necessity. And then we also want to help primary care achieve its goals, which can be summarized by the 4 C's of first contact, comprehensive care, continuity of care, and coordinating care. So that's what we really try to impress and imprint on our interns and our trainees about. So this is our training class. These were the people that just graduated this past June. We had our 2 fellows, Dr. Summers and Dr. Richardson, and then we just had our 3 interns, Kristen, Carly, and Alyssa. Dr. Summers came from George Fox University, which is in Portland, Oregon. Dr. Richardson came from Western Michigan University. Kristen and Carly both came from Pacific University, which is also in the Portland area. And then Alyssa came from us at Texas A&M University. All of them graduated, all of them did really well. Just to give a little overview of what an internship for a doctoral APA accredited internship really has to go through. We start recruiting and having application season around October, November. This year we received about 110 applicants, which was our most ever received, which is really great. In January, we have interviews that we had to do virtual for obvious things this past year with COVID, which is a really great experience that everybody probably has been experiencing. We interviewed about 40%, a little bit less than 40% of the people that applied. We then go through a match process similar to what medical residents go to their programs of being matched to a location. We onboard our new training class with our family medicine residents in June. July, they begin their first rotation. November, they begin their second one. And around March, they begin their third rotation. And I'll get into what those rotations are. And then they graduate in June, which again, all of them graduate. Our internship experiences, we have 3 clinic rotations. The first one is a pediatric rotation, which is they're doing primary care behavioral health services within our Yakima Peds Clinic, as well as our mothership clinic in Yakima, Central Washington Family Medicine. They also participate in groups, our teen health group that they participate in. On the rural rotation, they provide services at CWFM and then at our Natchez Clinic. And as I said, that's a rural clinic in the town of Natchez. During that rotation, they also participate in a pain class and as well as an adult general wellness group. And then our last rotation is our partnership with Yakima Neighborhood Health Services, and they provide PCBH services at Yakima Neighborhood Health and also provide services at The Space, which is a safe space for LGBTQ youths in the Yakima area. Additional experiences that they complete throughout the year, they have to do a critical analysis on certain concerns showing up in primary care. They have to do a quality improvement project, so following the Plan, Do, Study, Act process throughout the year. We have shared didactics that they attend with our medical residents when relevant, and obviously we have individual and group supervision that occur every single week. Our postdocs have similar experiences with the additional focus on becoming behavioral scientists in family medicine residency, so training our residents on patient-centered communication and behavioral medicine approaches, as well as learning to become future directors of integrated care programs, and that's what our hope is. So outcomes from this year, this is a thing that I was really excited to be able to share this with the people that have been reaching out about the grants and the outcomes. So our 5 trainees this year completed over 3,500 visits, behavioral health visits this year. They completed a total of almost 1,600 handoffs. And a handoff, again, being defined as a patient comes in to see their primary care provider, either the MA, the nurse, or the PCP identifies a behavioral health need. They ask for a BHC to see them, and we see them and complete a visit that day. So accessibility is literally happening in the moment, which is really important, especially as we all know what plagues our traditional mental health system is long wait lists. We see them that day. They completed almost 1,600 of those. My favorite stat, they served almost 2,000 unique individuals in our community. And when I think about the Yakima community and the patients that we have and our community members, 2,000 unique patients. And this was only our trainees that they did. And this doesn't include their experiences on Yakima Neighborhood Health Services. So this number is actually quite higher, but I'm just able to pull the data from our program. And I think one of the biggest things for training programs, as we all know on this call, is what's the financial realities of this? This grant, along with other grants, has allowed us this past year to have a net revenue be in the black of $175,000 for this past academic year. When we talk about sustainability and feasibility of continuing a training program going, this has been why we've been able to go to our leadership and say, can we do more? And thankfully, and with our a lot of compassion and grace and gratitude, we have been able to expand our program. Just to go over a little bit also about where our interns and fellows are placed. Dr. Gonzalez, Alyssa, she accepted a fellowship at the University of Wisconsin Health Sciences or Services, actually doing a pediatric oncology fellowship. Carly is actually going, Dr. Gleisler, she is going to Oregon Health Service or Science University in a pediatric integrated behavioral health and primary care fellowship. Dr. Thurman Kristen is accepted a fellowship at Providence Health System in Portland, again in integrated behavioral health and primary care. So everybody's staying in integrated care, with the most of our interns staying in primary care, and the two of them staying in the Pacific Northwest, which we really love. Our placements of our postdoctoral fellows, Dr. Richardson actually has accepted a position with us, so we're keeping her. That's what our goal is. Exactly, Carol. That is exactly what we hope to have. Dr. Summers, his partner is actually a resident that is doing their residency in New Jersey. So he just moved to New Jersey and is completing the residency there, or looking at jobs there. He's a hot commodity. I do also want to give a summary. Out of the interns that we have, all have received interviews and placed at their top choice for their fellowship programs. 3 out of the 11 interns that we have had since 2017 has stayed on at CHCW. All 11 have stayed in integrated care, working throughout the United States in a variety of different settings. Out of our fellows, 2 out of 6 have stayed on with us at CHCW, and all have stayed in integrated care, working throughout the US in a variety of different roles, including director roles, behavioral scientist roles, and a lot of them working in communities much like ours that are underserved and uninsured. So I'll summarize here our gratitude for this opportunity to, one, come and share, to receive funding to help to continue to expand our mission and our scope of our program. We get to serve our communities by doing this. It allows us to focus on training at the highest level. It allows us, as I said at the beginning, to live out our mission of service and education. And it has allowed us to expand. And that's the thing that we really, really appreciate. And we have so much gratitude for programs like this. And most of all, and our corny thing, I'm a psychologist, so I get to be corny. It allows us to be loved and a loving place for our community. So our gratitude for the opportunity.
Oof, David, that was quite a story, is quite a story. So thank you so much for taking the time to produce this presentation and to go into the depth that you have. We have a question on the line, and I hope there will be questions that you can just raise your hand and ask David, but let's start with Jean Clark, and she's asking, is there any plan to modify your approach to promote residents to stay in Washington State?
Yeah, this is the question that we've been asking ourselves, and this is why we started the program. We started this program in 2016. I still remember we were up at White Pass doing a ski it wasn't conference, it was our resident snow day, doesn't matter. But I was talking to our previous CEO, Mike Mabels, and Russell Meyer about this. And this was our main objective, was to try to get people to stay in the area for it. I would say, I think the biggest thing that we've run into is that with us being an internship and a fellowship program, people know about a program and they want to get training, and they come from all over the country. So a lot of times that causes them to go back. The thing that we have found, though, is that with us making relationships with different organizations throughout the community, and this is why we love our partnerships with Yakima Neighborhood Health Services, with the Yakima Valley Farm Workers, and in Health Point, our hope is that if we can't keep them at our site, that we can at least try to really entice them to stay in the area. And what we do to help with that is we have presenters come in throughout the year to talk about their opportunities at their clinics. We have, I forget the actual name, but it's a Washington State organization that tries to help recruit people to underserved areas in Washington. They come in and they present to our interns and fellows, and also talk about loan repayment. We're still trying to figure that out. I will say, when we have positions that are at CHCW to progress to like core full-time positions, we've been able to fill it with our trainees. We actually just had another intern that came back to us after she left for a fellowship. She actually just came back this past year to join our team as a core BHC. So it's still, I think, too early to tell if it's working about having people stay and come back. We've had some successes, but I definitely want to see that number get closer to 50% of people staying either in our organization or in the area of Yakima.
Thank you, David. Here's another question. This from Kevin Taylor. It reads, our prior speakers reported that they had trouble acquiring enough adequate applicants for their internship path. How do you explain that you had plenty of applicants?
Well, Kevin, the easiest way to explain this is that we're in a unique situation that, we're an APA accredited internship. So this is the final step that all doctorate psychologists have to go through. Essentially, it's their residency. So it's a whole process that people have to apply for. They have to interview. They have to, they match to us. I will say the reason why we've done so much better is that, one, integrated care is the new future of psychology, and everybody's getting on board with that. So when there's opportunities to get training in integrated care, it attracts people to that. We're able to offer a decent salary compared to other internship programs because of grants, because of the support here that also entices people. And we really do work our butts off to recruit from our local universities such as Wazoo, Pacific University, George Fox University. There's schools in Seattle. We go and we present to their students. We try to present as many national conferences as we can. And I think the word is out that our training program is a great one to come to, which has definitely helped the exponential growth in applicants to our setting.
Thank you, David. Now, I think that's all the questions in the chat box, but what about questions from the floor that you just want to raise your hand and ask David directly?
Dr. Martin has.
Kevin?
Yeah, so one of the things that CHCW and Health Point in King County have been able to do is maintain integrated BH using a model based around psychologists, as opposed to things like the Ames model, where usually it's a social worker who serves as the BHC or BHCM. How are you getting reimbursed for that?
Yeah, it's a great question. So one of the fortunate things within being a community health center, and then our state being very proactive about trying to fund behavioral health in the state, is there's an avenue for Medicaid that all of our psychologists, our doctoral level interns, they have to have a master's degree, which 95 to 99% of them have a master's degree en route to getting their doctorate. So as long as you have a master's degree, you can apply for the mental health counseling associate credential, which then allows them to bill Medicaid under a licensing supervisor. And that does mean that we have to review every one of their notes. It does mean we have to sign off on every one of their, almost 4,000 visits that we did, but that's what we have to do. So within Medicaid, and then since would be a qualifying provider as far as our Medicaid encounter rate, our program actually does very well just based on reimbursing or getting reimbursement. Now for Medicare and for private insurance, that's hit or miss. Obviously for Medicare, we're not going to get reimbursement from a master's level provider who's not a social worker. But overall, we've been able to do okay with that. And we actually, this past year, I am proud to announce we have taken on as a fellow our first social work fellow. So they have completed the social work master's degree from Walla Walla. It's a beautiful story. They were actually they're born and raised in the community, worked as a front desk staff member in our clinic, asked our BHCs, how do I become you? What do I have to do? They worked their ass off, getting their undergrad degree, getting their social work degree. And thankfully, we had the opportunity to then welcome them as a trainee as they get their hours and then progress to a core BHC. We've been able to do that this past year. So we're trying to expand out to other forms outside of just the psychologist role for other master's level providers.
Thank you, David. We have time for one more question, let's say, before we shove on to the fourth presentation. Surely there's more questions of this successful and relatively large program that we see from.
I can't help myself, so I'm going to ask another question. Sorry. Hey, David. So are you doing any outreach in the schools, like in the K-12 system, in terms of encouraging interest in behavioral health careers? And if not, we should talk.
Yeah, well, Dan, it's great to see you. And I think we should talk no matter what. The one thing, so we do have a school-based health clinic that we've been able to embed at Davis. We've also had some strategies. Our postdoctoral fellow actually did a presentation at Titan, I think it was their high school or their school administration, about our model about being a behavioral health provider. And the other thing that we just do informally, I wish it was more formalized, we do informally, is that since we're a training institute, we offer, I do it with every single teenager that I have, is that if you ever want to come and shadow what I do as a BHC, if you want to shadow one of our providers, we have a very easy avenue for people to do that. So we're trying to do outreach for that more. This is one of our primary priorities in the coming year, is to outreach more to our community, particularly high schools, about getting more involvement in the BHC role.
Great. Thanks, David.
All right, Dan, I'm sure you and David can continue to talk over a good cup of coffee in downtown Yakima. But
and the thing that I'll add to this as I end up and wrap up, and I actually have to go on to do supervision actually with our social work intern fellow, keep the funding coming. We love it. And again, our gratitude for this, it shows our program. And I think most importantly, it has impacted our community in such a profound way. So please, and well, thank you, first of all. We have so much gratitude for this support. And if there's opportunities to continue it, it would mean the world to us.
Okay.
David, I think you have the right people on the line to hear that message. So thank you.
If you ever want to come visit us, in shadow, we have people come all the time. So definitely just let us know. We would love to host anybody.
All right, David. Thank you. Thank you so much for your presentation and appreciate your time. Our fourth presentation is from Somerset Counseling Center. I saw Tammy, and I think that was Mac, Scott Sack on the line. So the floor is yours for the next 10 minutes or so. And you have a presentation as well. Wonderful.
Hello, everybody. I'm Mac, and this is Tammy. We are from Somerset, and we have this awesome presentation to just talk about what we've got to do over the last year together. How do we want to do the next slide? So firstly, I just want to take a second to thank GCACH for the opportunity to spend a year in the behavioral health field learning and exploring, practicing different modalities, and discovering the importance of being an active member of the substance use disorder treatment and recovery field. So thank you very, very much. It's been an honor and a privilege to get to work hand in hand and work directly with Tammy, who was my preceptor / mentor. And so being brand new to the field, I came in with absolutely no experience. You know what I mean? I've got 12-step experience myself, but not really learning how to use different modalities for counseling techniques and things of that nature. I got to watch that and observe and then practice, you know, trial and error and some things. And it was really cool to get to be a part of that. I was just adding up some stuff, and over the last year, we've done around 500 hours of intensive outpatient treatment together, and about another 105 hours of family therapy. And Tammy and I got the privilege to meet every Thursday to case manage, you know, set goals and check in with one another. And it was really, really awesome. So do we want to hit the next slide, please?
Hi, my name is Tammy. First, I'd like to say that I'm still proofreading Mac's reports, re-engagement letters, you know, drug court reports, assessments, intakes, and of course our presentation. Because as soon as I proofread it, I had to correct some errors, you know. But I want to appreciate the fact that my boss obviously felt comfortable enough to allow him to share my office, which was a big deal, although my office is quite huge, you know. But I got to oversee and hear, even though I was doing specific work, you know, and he got to observe, you know, firsthand, like, oh, you worded it this way, you know, and he would write down keywords. So it was a good learning. This has been an honor to have the pleasure in training an intern while he carried his SUDPT with Somerset Counseling Center. Mac attends school full-time in hopes to have the availability to be hired on full-time as well with Somerset Counseling, which, by the way, he has officially July.
Yes.
Yes.
July 1st. I was hired on full-time. So.
Yeah, you know, but having this intern really allows you to have that possibility of the benefit of, you know, is it a perfect fit, good fit, you know, plenty of other things, because, you know, 80% is case management, while 20% is counseling. So people have to be able to do the 80%. Okay, Somerset wants to thank GCACH, which is weird because we didn't actually read our PowerPoint, you know, but we were both very thankful for allowing us to have an intern to help, excuse me, be who he dreamed of being when he grew up, which is totally awesome considering I met him somewhere else. You know, and he asked if he could come aboard, and at the time he wasn't really hiring. But having this opportunity of an intern allowed us, you know, to have another individual willing to learn, and now he's being an SUDPT. Mr. Scott taught me as well how to have more empathy towards an individual that has never had any experience with SUDPT. I apologize. However, what he observed is I give plenty of empathy towards our patients. So of course I'm drained, and you know, he would remind me, can I have 2%? Mackenzie and I set goals for him to accomplish in order to understand the field of SUDP. The most important one was for him to understand theories. I'm a big, huge theories is like, if you don't understand them, you need to understand them, because how you approach patients is really crucial. Pick a theory, like I said, and he would feel the most comfortable educating and implementing. One of my strong points is motivation interviewing, and I would throw CBT out there. So he really did pick up on those. Mackenzie learned how to identify the patient's barriers, break through those barriers, and be able to understand how to set goals that are specific, measurable, realistic, attainable into the productive ISP, which is crucial because that's a main thing, not only to get the education of how to stay clean, but what they would like to work on personally while they learn to stay clean.
Next slide. Thank you.
The education that was taught was Mackenzie learned how also, how to process in group, open-ended questions and CBT, which I already covered. I apologize. Negative patterns of thought about the self and the world are challenged in order to alter unwanted behavior patterns. Mac learned about confidentiality and the sole purpose of upholding one's confidentiality. That's a big deal, very huge. Mac has been learning about the family sessions as well and how to de-escalate family members. I've been having the privilege of doing family sessions, and Mac has been able to do them with me still today, by the way, which is very important because I really like to have a backup in case I go to vacation or I happen to be sick, and he's learning the process. Max asks many questions while learning what it looks like to have his own caseload. He officially now has his own caseload. He has training in motivation interviewing, which is a psychotherapeutic approach that attempts to move a patient away from the state of indecision or uncertainty and towards finding motivation to making positive decisions and accomplishing established goals. ASAM, which is crucial, the 6 dimensions, he's got to understand what those dimensions stood for, how to break it down with the information that the patients gave us, and where specifically that they are supposed to go. And he probably has them memorized now. We spent 10 hours a day. So, and he mentioned like 3 to 5 hours of one-on-one. What he means is that that's when we wasn't really doing any work, but we were really going, how's it working? What can we do better? And continue to set goals. But he was at my hip for 10 hours a day, 10. Wherever I went besides the restroom, he was there.
It was great, yes.
And I just, how awesome is that? To be able to spend all day long learning and learning and learning. Next goal.
Next slide, please. I don't know if it's controlling it, but thank you.
And this I added to it because it is the family session that he's learning, and there's very different levels. So you have to remember that family have a lot of anger, resentment. Mac used to use the word "you will," "you must," and it's like, woo, those are fighting words, which I would have to de-escalate, and come back at it with specific language that needs to be used, which I talked about. So he learned not to describe what a patient is feeling. Instead, ask the patient how he or she is feeling. He learned to tell me about that and how he went about it. Like, oh, I thought of this, and is this appropriate? And I would say absolutely. And we went on to how does that feel instead of, do you feel this? Because you don't want to fill in that open-ended question, and that's what I told him. I said, allow them.
One of the things that we're still working on today, and I think I've got a pretty good concept of it, but we try not to rescue our patients when they're feeling feelings and stuff, right? And last night I had a slip and I gave someone a tissue, but trial and error, right? And it's interesting because we feel for our patients when we're, going through education and we're processing different things. And that just popped into my head from what we did last night, because our family sessions are every Wednesday. So.
And with this little education of the anger escalation, I mean, he definitely went from the extreme all the way up to healthy, when it pertained to family. I mean, you can use that also in group settings, which he's doing quite well. And what I know about why he's doing that quite well is because I hear a bunch of patients of his board work, of his information that he's given, for IOP, because he is the new IOP counselor. Yay, I'm not doing that no more. I've been doing an IOP for a very long time. So with that, we'll.
Next slide. So this is something I really wanted to talk about. One of my big things in my personal, I guess, if you will, like one of my mission statements or however we want to call it, is care coordination. When we're dealing with substance use disorder, we have a lot of very needy people, they need a lot of handholding and assistance. And so finding what our community resources are and our partners within them and resources to assist and break down barriers to care and barriers to life so that we can really assess all 6 dimensions of a person's, substance use disorder, right? And so part of this internship, I really got to, I got to work with Catholic Charities and understand the referral process and, following up to make sure patients, made their appointments or, if they decline services, why. One of my favorite ones, and I do a lot of work with, is the Opiate Resource Network. And I don't know if Teresa's on here or not, but I talk to her a lot. We text a lot back and forth. We talk about getting Narcan for people because there's a huge epidemic right now with these pills that are on the street. And it's horrifying. And getting people to stop and stay stopped is really, really intense, for them to break that cycle. So we get Narcan and I give it out to patients, and I get to do that because of the ORN. Consistent care partners with ORN, and that's where we get to tackle housing and employment and resume building and getting food assistance and bus vouchers. MRJN focuses a lot on employment. New Start is the MAC clinic, and housing.
Yes.
And the New Start is right across the street from our agency, and we have a partnership with them, and we refer our patients over there for medication assisted treatment. And it's really, really important. And then, of course, Oxford Housing, helping our patients advocate for house interviews, getting them funding, while they're at inpatient treatment, because we have this really small window of time where a patient is willing, right? And if we miss that, we're kind of, for lack of any other word, SOL, if you will, and it's back to the drawing board. And I put DSHS on there because when I meet with my patients, I do a lot of phone calls, helping them get a new EBT card or asking about, what kind of help they can get. And, the people that we deal with are a very, they're a very needy population, like I said. And so, making those phone calls with them and just sitting with them while they do that is huge. And Somerset is huge on care coordination and, really advocating for our patients and allowing them to know and understand that somebody actually cares, Because a lot of people, a lot of our patients just need to be heard. So, and I learned all of this because of Tammy. I don't want to, I think it's very important that, when I walked in here, my first day or two, I stuffed a lot of envelopes because we were in the middle of a pandemic. I mean, we're still in a pandemic, but everything was on Zoom and telehealth and phone calls. And within the first month, we were doing groups together and I was getting to find education. And, Tammy does a really good job at executing and helping me understand things, right? And asking the questions. And so if anybody ever needs a trainer, she's gonna hate me for that, but she's really, really good at that kind of stuff. So yes, community partnerships are important and the resources in our community. So we'd like to thank them as well. Next slide. Is there a next slide?
I think that's it.
All right.
But thank you, Tammy. Thank you, Mac. Let's keep the floor open a couple minutes for questions now. I just want to say that was quite a nice contrast to what we heard from Community Health of Central Washington and sort of the big picture and how that works with a much larger organization to have this sort of micro view and how it works between an intern and a preceptor. I thought that was highly informative. And if there's some questions from folks on those lines, that's great. If not, if you have questions in general for these two, let's get them out on the table before we take a break.
Raise your hand. Please raise your hand.
What? You have a question? We're not.
So Patrick, I'll just comment that how wonderful it is that you guys are doing so much care coordination within your organization, because I think with the client base that you have, that they really need those resources. So just wanted to thank you for all that community outreach and going above and beyond just the treatment that they get in the clinic.
Thank you, Carol.
Well, I have a question.
You're supposed to have the answers, not the questions.
Well, I mean, we appreciated so much to have Intern and, to be able to have the grant. Just don't leave us out. Think of us. And let us know what we got to do, to further the process. I mean, we know what we did, in order for you guys to choose us. I just want to make sure that you don't forget us.
Stay tuned, Tammy.
All right, that'll be coming up, not today, but soon. Okay, any last minute questions of Tammy and Mac before we take a break? Well then, you two, thank you once again for that detailed view of how that works between two people, an intern and a preceptor, and I hope we can learn from your experience. So we'll take a break now for 10 minutes, and I hope you two can stay in the line. When we come back at 10:30, we'll have a report out from 3 more organizations who were recipients of these grants from the ACH. So take a break, take a cup of coffee, take a stretch, get some fresh air, hopefully not too smoky, and we'll be back shortly. Hello, everyone again. Chelsea, I think you can take that slide down. It is 10:30 and we're going into the second half of our learning session this morning, hearing from 3 other organizations who have participated in the internship preceptorship program of the ACH. And we have Sundown M Ranch on first, and Mark Lois, I don't know if I'm correct in pronouncing that, but hope I got somewhat close. You're going to be the presenter, right?
Correct.
The floor is yours, Mark.
Good morning.
Good morning.
Love the presentation so far. Love the Max enthusiasm in the last one. That is contagious. Go ahead and give me the next slide, please. So we've been doing interns since 1973. So we're an old organization founded in 1968. You know, being in a kind of rural community, it's tough to recruit credentialed or licensed folks. So we've pretty much grown our own from the start. One of the things we've been doing for a really long time is precepting behavioral health rotations for many other agencies and educational institutions. So that goes all the way back to 1972, I believe, or 73. We're not precisely sure. And that was Central Washington Family Medicine. We started doing behavioral health rotations with them. Long-standing relationships with the University of Washington, with Washington State University, Seattle University, and the last few years, every PNWU student has come through in their first year, and many come back their second year and do a much more intensive rotation. The pandemic has really killed these activities. So initially, this project was going to be precepting with medical schools, and with the pandemic, that was next pretty much impossible. So we decided to do a couple more of our own interns, and we've had a long-standing program for that. So that's all driven by the WAC, the Washington Administrative Code. And there's policy and procedure been in place for a long time for developing SUDPs to Ts to SUDPs. Next slide. So with the pandemic, we've had a reduced census. So I'm running about 80% capacity, which obviously reduces revenue. So the additional funding, thank you to the GCACH for the additional funding that allowed for us to increase some intern activities. And we focused the project on 3 of our SUDPTs, and all 3 met the requirements for the specific policy and procedure which we developed for the GCACH project. So all 3 interns attended several of the GCACH learning collaboratives, all have advanced towards credentialing. Interesting, you know, we've had a long-standing program for developing interns, but clearly more attention was paid to them through this project. So, you know, there's some funny stories about that. So, you know, working here for 20 plus years, I've helped supervise many of our credentialed folks, and they're all like, you know, hey, I didn't get this much attention when I was an intern. So, because I was checking in on the 3 that were part of the project pretty regularly and making sure they were on point and on task. So that was a unexpected benefit, and we'll continue. I think I'll continue to be more involved with their clinical supervision. Next. So these are some direct quotes from the 3 interns. This project benefited me in many ways. First of all, feeling more included in recent news and trainings Second, overall care for my training as an intern, providing more attention and supervision. And last, feeling cared for and confident in my company and their commitment to providing clients with the best therapeutic treatment possible. Next one, I have been able to find more autonomy in my work. I feel that at this time I require less reminders to get my case management done. It's refreshing to know that I can feel more secure in this aspect due to the guidance of my training team. I think that it is great that I've been able to train with other experienced counselors and supervisors so that I know which ways I can improve. This helps me to feel safe and secure in asking for help and to allow me to not feel alone in this process. Counseling can be very stressful, and to know I have people in my corner to support me, even when it's regarding the ugly stuff. And lastly, the project benefited me by providing me with the insight, tools, and resources necessary for growth and development. I'm a firm believer that one should always strive for evolution in their vocational field, and I'm grateful for Sundown's internship project, as it has me well equipped for the upcoming exam. SMR's internship project is fully invested in molding their interns into certified counselors. What I enjoy most about the project is the supportive hands-on approach to learning. As interns, we are all given the freedom to practice what we have learned in terms of substance abuse intervention. Our learning is not limited to note-taking, as the intern project does an excellent job amalgamating the educational and experiential learning objectives, so we as interns are prepared to apply these modalities in the occupational field. Next slide. So intern one had 4,095 documented hours with one required class left for their degree, and they plan to test this fall or winter. Intern two is over the 2,500 required hours with a few classes left and plans to test in the fall of 2022. And intern three completed an AAS and then a BBA in business and has 2 classes left for a master's degree in mental health counseling with over 4,000 hours of training. And I believe they took the test on 8/15/21. We do not know the results of that test yet. I'm confident that they passed. Next slide. So one of the great losses during the pandemic is our inability to have visiting, which has really, killed our rotation. So I got medical schools reaching out regularly trying to place students, and I think this is just a huge problem across the whole system. When I wrote this, we were kind of in a position to where it looked like things were going to get better, and then since then we've had 2 mandates for vaccines and masks again. So I just I kind of feel for these students. I don't know where they're going to get their hours. We'll continue to provide intern opportunities for SUDPTs internally. We have 12 SUDPTs working towards credentials currently. This project increased it increased our budget to have more interns, and it also increased the attention on them, not just from the clinical supervision view, which is all a requirement of the WAC anyway, but more so from the administrative side. We've always been I think is a strength for us is the clinical supervision, but all 3 felt that they were more connected and supported during the project than before. Next slide. Really want to thank the GCACH for this opportunity. This has been a great partnership for these last few years on multiple projects. The transformation project has been an incredible opportunity, asset, growth for our organization. In a year where admits and revenue was down due to the pandemic, the project provided opportunities for interns that I do not believe we would have been able to provide without the extra funding. And with the workforce shortage, this is just an awesome activity to bring much needed personnel into the field. I think anytime we can add some dollars to help organizations bring more people in. It just grows the field and grows our workforce. And clearly the project strengthened our intern program. Hoping for another opportunity. Next slide. That's it.
All right, Mark, thank you so much. We have time for questions of the Sundown M Ranch experience with the internship preceptorship program. Any questions of Mark? While people are formulating their questions, Mark, I've got a question for you. So
yeah.
12, if I understood you correctly, you have 12 interns coming through on any given year. Is that, or was that just a high year? That seems like a lot. And what's it like as from your end of the, from your side of the table to manage that much training?
Great question. So that's pretty normal. I mean, pre-COVID, you know, people that we feel have competency and are equipped to move into internship, we kind of like to grow our own counselors. We'll move them along. So I think 10 is probably a pretty average number for us. Rotations wise, I mean, we're doing pre-COVID, we were doing over 2,000 free preceptor hours in behavioral health annually for the various medical schools and a couple of the clinics. So this has been a high priority for the organization for, you know, going all the way back to the early 70s. And for the most part, I coordinate all that. I mean, there's some reporting requirements and stuff. I don't do the direct clinical supervision, but we have 6 qualified clinical supervisors here. So there's plenty of supervision to spread around to make sure the interns get their needs met and get quality supervision.
Mm-hmm. Okay. Thank you. Questions of Mark and Sundown M Ranch?
There's a question in the chat, Patrick.
Oh, I'm sorry, I didn't catch that. So the question from Laurel is, do you have more constraints to being able to place interns because you have the inpatient program? More constraints because of that?
Absolutely, yeah. Being a residential treatment facility, it's really limited on the visiting. I mean, all the outpatient services we're still doing 100% telehealth for all outpatient services, and I'm still not doing any visiting. So student, you could argue a vaccinated student, I mean, is there a way to manage that? There might be. It's probably more than we want to take on until the guidelines are lessened.
Okay. Further questions of the Sundown M Ranch experience?
Patrick, I would just say that I think we have a couple of people from the Healthcare Authority. I don't know if they can answer Mark's questions about the health guidelines or give us some kind of a preview. I'm sure this isn't unique to Sundown. I'm sure other organizations are experiencing some restrictions and barriers because of these guidelines. And I'm going to put Suzanne on the spot, maybe, if she's still there. Suzanne, do you have any information whether or not at the state level they're taking a look at modifying these guidelines or even making them a little bit more stringent?
Don't know if Suzanne's still with us. Anybody else from HCA want to tackle that hot potato question?
Patrick, I'm here.
Oh, you are there, Suzanne.
Yes, you caught me getting a cup of coffee.
That's allowed.
Okay. So because I was across the room, will you reframe the question for me again? I know we were talking about guidelines and I want to make sure I'm answering the question accurately. Steve Perry is on the line too. So between the two of us, we can at least formulate a response to look into things.
Okay, this is a question from Carol about Mark's comments about guidelines in their experience with HCA.
Actually, Mark, could you reframe the question?
That would be perfect. Thank you.
Absolutely. Mainly, it's tough to do preceptors externally. So to bring in med students because of the way that the guidelines are for a residential treatment facility. So when even when say back in the spring when they kind of loosened up guidelines for the general public, they really didn't. The CDC didn't loosen any guidelines for facilities, for healthcare facilities. So in other words, that's a barrier to doing preceptorships.
So this is a COVID-related guideline question then, Mark?
Yes, correct.
Okay. I think it's best for Steve and I to take the question back. What I think it would be nice to do, Carol, if we can get you and Mark connected up and just send us the question in writing so we can get you to the right place to get an answer. I don't want to misspeak for you, Mark, because these guidelines change and evolve. Right. And so what I'm answering may be even weeks or months old. So let's make sure we're getting you the most recent guidance we can and getting you to the right resource for that. So if you and Carol would formulate a question, and Carol knows how to get a hold of Steve, and I will chase down an answer for you, or at least a contact person.
Thank you, Suzanne.
You're welcome.
And if I could, this is Laurel, if I could just speak into that. I covered for Martine for a little while and worked with Mark as their practice transformation navigator, and became aware of what wonderful work they're doing at Sundown M Ranch. And because their residential treatment program, they're under such constraint to have anyone outside of their employees into the organization that it's very difficult. And I know it's such a difficult situation we find ourselves in with the pandemic, but just want to make sure that you hear the heart of the question, which is, oh, it would really be wonderful to find some way to be able to get continue to train to let Sundown M be the trainers for people to come in and learn from and be able to spread that good work, not only at Sundown M potentially, but other facilities within our state.
I appreciate your comments, because kind of what I hear in Mark's question is twofold, which is, simply what are the COVID guidelines? But beyond that, I also heard questions about residential treatment facilities. And I know there are a different form of treatment, and so it deserves a question about how that is considered. And if there's any follow-up you'd want to do in talking with the folks at the state about that, we can see what we can do to make a connection for you to get the answers in the right place.
Right.
So thank you for framing it out from both angles.
Thank you, Suzanne. I think we're going to shove on and hear our, excuse me, our is it sixth presenter? Yes. And this is from Trilogy Recovery Community, and we have Megan on the line, Megan Tolliver. So Megan, the floor for the next 10 minutes at least is yours. Go ahead.
Thank you so much. Thank you for the time here today to thank you guys for this funding that was vital in the services that we did over the last year. Let's see, so you're going to be going through the slides on your end there. Thank you.
Yeah,
perfect.
Yeah, next for you, if that works for you.
Yes. So Trilogy is a nonprofit here in Walla Walla, Washington that provides recovery support. We're classified as a recovery community organization. And we have recovery coaches. We do provide counseling as well, but we provide peer-based support primarily. So our vision is universal destigmatized access to recovery from substance misuse and addiction. And we provide services that help people achieve optimal recovery. And like I said, through peer-based trauma-informed practices backed by evidence. Our mission is to support youth, adults, and families in the Walla Walla Valley on their paths of recovery from addiction or substance misuse. And we provide these services in various locations. One of the interns that I'll talk about later today provided services at a local high school. We also have provided services in the past at the jail, as well as the Juvenile Justice Center, And we also provide our services out of our location, our office location here in Walla Walla. And next slide. All right, so presenting to this group, we all know why we're here, but I'll just reiterate. So more than 93,000 Americans died of drug overdoses in 2020, and that's up more than 30% from 2019. Again, we're all very aware of that, especially this group here today. Underage drinking contributes to the 3 leading causes of death. So this is an unintentional injury, homicide, and suicide among persons aged 12 to 20 years old. And that's why we feel it's important to address the youth population. Risky substance use and addiction is the leading cause of preventable death in the United States. Again, these statistics are nothing new to this group, but that does drive the services that we provide. So when it comes to your support of Trilogy, we were able to have part of a position covered for our school recovery support ally position. Like I said, at a local high school and college place that provided recovery support. The program that she provides is called Project Success, and it's a prevention and early intervention evidence-based practice that provides presentations for faculty and students, as well as small groups, and then individual support for students that need recovery support. And we had actually one individual who started in this position, and then she took another position, and then we replaced her with Lucinda, but both of them were working on their masters in social work. And Lucinda, who's continuing with us now, is working on her master's in social work from West Virginia University. And so we provide the oversight. So actually our program director was here earlier. He had to step out at 10. Oliver Birchwood Glover provides the oversight for this position. He's a licensed social worker and oversees the work that she does because she has the master's level experience. But she received certificates in, so the Recovery to Practice certificate is through NADAC, and we approach this field from the recovery perspective. So we try to provide both that clinical support, but also other opportunities for enhanced knowledge in the recovery field. So that's a certificate through NADAC, and she's also been trained in SMART Recovery, which is a mutual aid support group that we provide here at Trilogy. Let's see. And she's also a member of various community groups, and that's so that we can continue to report out about the work that we're doing, as well as understand what other agencies are doing, and continue to have that collaboration within the community. Yeah, so with Lucinda, I did want to share, she's continuing with us. It was really important to get that financial support to offer a paid internship while she's getting her master's. We actually have a lot of individuals interested in doing internships with us, and we've had to turn down quite a few just because we are a very small organization. We only have so much capacity. And when we do internships, we want to do them well. But we were very appreciative of this opportunity to provide a paid internship for this position to be at the school and while she's receiving her master's. Let's see, and I wanted to just read a quote from her. She said, in looking back at the last school year, she said, I never knew how important it was to have a school recovery support ally in a high school until I started this position. School support is essential for supporting youth recovery because it offers direct access to the services that they need. Being a school recovery support ally has been the most honorable position I've ever had, and I'm delighted to be a part of youth recovery services that take place in an accessible school environment. So we're very excited to continue this position the next school year. You know, we have worked with the school district. They provide half of her salary to be there, which is, we feel, is very vital because it shows how much they want us to be there, really. But this year, you know, we have that half covered through the school district, but we are still applying for grants to cover the other half of that position. But we're very, very appreciative of this grant last year. And then the next slide. So the other position that we had covered through this grant was Angela Queen, who's a recovery coach. So like I said, we provide peer-based support. So she is a person in recovery that wants to continue to do this, the work in this field. She has 2 years in recovery, and through this position, she has received a lot of training to do the work and give back here. She completed the recovery coach training through the Connecticut Community for Addiction Recovery, and has since, actually this week, is now doing the peer counselor, it's a certified peer counselor training through Washington State, which is the next step that sort of officially recognizes her as a recovery coach. And she's done the Recovery to Practice certificate through NADAC, SMART meeting facilitator, and she's a member of NADAC. She provided groups, a SMART recovery group at Whitman College for students there on campus to receive support. And she provides groups at the Juvenile Justice Center for youth there. She also provides groups here at Trilogy for adults in SMART recovery and provides individual recovery coaching. So she was with us in an AmeriCorps capacity for the last year, and has since, we have now hired her as an employee. So this internship allowed us to kind of start that first year, getting her the education that she needed to be a recovery coach, and then be able to take her on as an employee. And we're really excited about that. We honestly want an army of recovery coaches, and we hope to have that in the future. Let's see, so I wanted to read a quote from her. She said, in looking back at her service year, I really enjoyed my time serving as AmeriCorps and a member at Trilogy Recovery Community through this internship program. As a person in recovery, it has been quite a journey, being able to give back and help those in need. The training I've completed has helped me grow as a person and in my recovery. Being a recovery coach is something I'm very passionate about. Instead of having regret and shame about my past, I've been able to take my experience with addiction and turn it into a positive in helping others. I'm beyond grateful for this experience. So that's Angela. Next slide. So our impact here, so yeah, addiction is a chronic disease that can be managed, but no treatment will make addiction disappear. This is why Trilogy believes in the community approach to recovery. So we're able to provide recovery support to folks before treatment, while they're going to treatment, they're at Serenity Point, an outpatient program perhaps. Also when they come back from inpatient treatment, we're really trying to provide that continuity of support. I've personally referred a lot of people to Sundown M Ranch. They're a great facility, and it's great to see you guys here. And so, yes, our approach is to provide that long-term care. So although COVID-19 it really did slow down our programming and our capacity to support individuals, but we did continue to do what we could, either in smaller groups or virtually, and our recovery coaches continued to assist and mentor over 500 individuals and families in recovery. So we offer our services to no cost to the individual. Right now, we are not billing insurance. Like I said, we're having our recovery coaches get certified through the state so that billing Medicaid could be an option in the future for sustainability. But in the past, we've really appreciated the capacity to not charge for our services and offer them to anyone that needs them. Really, if they say they need help, or if a family member is with them and encouraging them to get help, we will be able to support them. And we hope to continue in that capacity to meet the needs of our peers. Next slide. So the GCACH contribution has made an immediate impact on the level of services we're able to provide. Like I said, I mean, we have a small staff based, but you guys were, with that financial support, we were able to provide that training and then take on and continue with the employment of those individuals after their training. And, recovery, the GCACH award allowed us to hire and train recovery coaches, or that specifically Angela, who addressed the needs of peers seeking to live self-directed lives not controlled by a substance. And like I said, we need more. We need an army of recovery coaches. Our hope is to grow that capacity. And like I said, we do have clinical services as well, but we know that having both that recovery coach that can walk alongside someone in recovery, and then being able to offer that clinical perspective as well, is kind of that wraparound service, and then referring them to, like I said, local treatment facilities like Serenity Point, or inpatient treatment if that's needed as well. So we really appreciate GCACH for this grant this last year. It made a huge impact on our small organization. Next slide. And thank you.
Thank you, Megan. That was an interesting perspective, and I learned a lot. And it's good to see that emphasis on youth and innovative program with, is that the College Place High School, right?
Yes, College Place High School.
Yeah, great. Any quick questions of Megan and Trilogy in general from their experience in Walla Walla?
I could just add, Patrick, that Megan, we were really interested in this application when it came out in April or February of 2020. We had not worked with Trilogy before, so we were really excited to have a new partner. it's so exciting to hear the work that you've been doing in the school, because that's sorely needed, as we know, in our region. So just wanted to thank you guys for the great work that you're doing, especially in the high schools, to help our kids, you know, lead better lives and get on track. So thank you so much.
Thank you.
All right. Here's a question from Terry Jane Osborne. Do we get contact information to reach all those who have presented? I'm sure we can. Chelsea, I'm just going to pose the question to you. We can get that out to everybody who has participated this morning.
Yeah, as long as everyone, the presenters are okay with us sharing that information, we'll definitely include that in our minutes or in the packet that is posted online next week.
Okay, great. Very good. So any more questions in the last minute or two we have with Megan about the trilogy experience with the GCACH internship program? Well, thank you, Megan, and hope you can stay tuned now for the last presentation we have, which is from Yakima, almost the other end of our geographical distance. And we have two presenters, Mary O'Brien and Norma Martinez from the Yakima Valley Farm Workers Clinic. So I don't know whether Mary or Norma is going to start, but the floor is yours.
Well, thank you. Good morning, everybody. Yeah, we're going to co-present, and I'm going to get started here, but just wanted to, again, extend a big thank you for GCACH for, again, allowing all of us to benefit from this project and being able to, again, bring on interns into our agencies. I want to do a little quick acknowledgement. On the line with us, besides Norma and myself, is Katie Gooddale. She is a program coordinator here at Behavioral Health, also helped us with some reports. I know that Sandra Suarez is also with us. She's a senior manager with our Planning and Development Department. But just wanted to let folks know. Again, we're very excited about getting, again, the project funds. I have a long history of entertaining interns here at Behavioral Health Services as part of Farm Workers Clinic. Probably in the last 20 years, I've had many interns in specialty services. We do have, again, medical, dental, and integrated care services in behavioral health that are separate from specialty services, but this is my area. So again, we looked at bringing on bachelor level, master level folks that are interested in clinical work. And again, that was sort of our interest into expanding and offering that this past year with this funds. But like I said, in my past 20 years, I've had a lot of good relationships with the local universities, again, offering to work with us and placing students with us, and also supporting them. But we decided that with the additional funding that it would be beneficial to have somebody like Norma really focus full-time, not full-time, but most of her time towards that, so that it could again provide the necessary support to the students. We had, again, somebody mentioned earlier, there's always a lot of students seeking placement that this past year, it was very difficult for us to entertain all those requests, but we did the best that we could. And again, Norma's going to talk in more detail about the students that we decided to, again, support with this project and the type of work that she had to do so that we could, again, allow those students to be in our setting. So with that, I'm going to pass it to Norma so that she can start in more detail about the students and the work that she did with them.
Okay, so if you could go ahead and go to the next slide. Right there at the bottom. So I'm Norma Martinez, and I graduated from Walla Walla University and became licensed in 2019. I have worked for the agency here in September. It'll be 12 years. I myself had the opportunity to be an intern back in 2013. I was working for the agency about 3 years and decided to proceed with my master's, and I became in contact with Mary, and I transitioned from a community health perspective to a behavioral health perspective in clinical. And so it's been a journey here at the agency. I have had the opportunity to have several positions and gain a lot of experience, and now I get to give that back to someone else. So it's been a pleasure to feel that I can do that. Especially, I feel like this position in itself really is rewarding to me due to that matter. So if you want to go ahead and go to the next slide. So as Mary mentioned, we did serve 6 participants, 6 interns in the agency. We accommodated to 1 intern who was at a bachelor level from Heritage University. We were able to place this student with our public health education department, in which she was learning about parenting programs, interventions, pre-intervention models. And so really just supporting groups for the parenting models and assessments and recruitment. So she gained a lot of experience in that area. We were able to support 3 interns at a master level. And in addition, I think, one of the things that makes me proud is to see their female Latinas, which we know that that's difficult in itself to see, especially nationwide. We have a very small amount of Latinas female who are graduating with master's degrees. And so we were very happy to be able to support them. We had one as a behavioral health consultant supporting with various things. One was a research component of things, recruitment of a program that we, aside from this, we worked with Heritage University and their bachelor's program. It was I think they had this contract for about 3 years where they were supporting bachelor level students understand the cognitive behavioral therapy. And so they would have the opportunity to actually go through training and have a small caseload. And so we had one intern just she did very well in recruitment and allowing us to seek for appropriate clients here in the agency that would benefit from this program. she participated in the research component. It was really neat for this individual to do this because she herself had been one of the students in that cohort, so she got to see like the two sides of the coin. She was able to do the behavioral and have a caseload, and then she was able to do the research component side of things and recruitment assessments. And then towards the end of her internship, she really focused with our behavioral health consultant and carrying a small caseload. We also had another master level from Walden University, and she was able to work with the WISE program and also shadow myself in clinical work and just really work together and helping her understand the process of the biopsychosocial, just that clinical aspect of things, creating treatment plans, writing SOAP notes, you know, accommodating to students. She was able to complete another a CBT program. It's about 10 hours that we provided support with, and then also participated in trainings for like suicide prevention. Most of the interns did. We had another student from Central Washington University, and this is a student who was not an employee of ours. We were able to support this person at our Children's Village program, where he got to observe, again, the clinicians do behavioral support for children who have specialized needs. Another intern, she worked in our foster care program and placement program, and that was her internship and the recruitment and seeing that process. And so, yeah, we had several pending. We have 2 upcoming interns, one at actually 2 at a bachelor level from Heritage University that we are planning to support this upcoming year. We did get several inquiries from different places that, unfortunately, due to COVID and restrictions and a lot of factors, we were not able to support, but we were happy to see that they were inquiring and that we could be that potential place that they could seek. All right, so we'll go to the next slide. So as a clinical supervisor, as Mary said, this funding really supported getting me involved as a supervisor, because it does take a lot of time to be able to do this position. The school requirements are pretty intense. I did about 30 hours of just faculty training in the different schools. So that's kind of like a total, but there was some that consisted, I mean, with me writing notes and just really being focused in the trainings. One took me like 16 hours. Another one was like, 15 to 18 hours. It was just like different modules, different various levels from a bachelor to a master level. And so there was to be a faculty and sign off on the students' internships. You really had to just go through these trainings to be able to do that and participate as a faculty supervisor. So we accommodated a lot to the social work. We did have another student from Central who did a counseling program there through that university. But a lot of it was working with the students and really getting their competencies down, the ethical, the professional behavior, engaging in practice, the research, policy. We used a lot of different trainings to be able to provide this. We used NAMI, we used several different, the agency in itself of the trainings that were provided. We used self-care services, the CBT training, all patient suicide prevention, cultural trainings. And so I just really dug deep and looked at different potential trainings and created myself a list to be able to provide to this intern. So we did provide 1 hour of supervision, if not more, if needed, but 1 hour of supervision on my end. And then whoever they were working with, and they would be supervised by that particular person. And so we have a lot of communication on that end. Okay, so next slide. So Mary will talk about some of our challenges and the internship.
Yeah, most of it was good. Again, like I said, I think again, we continue to learn from our students, our interns, again, the various demands of the field. But again, there is some challenges. And the first one is, again, as Norma said, again, each university has their own processes and requirements. Again, to be a field faculty person, to sign off on interns, we are required to get oriented by the various universities. And it does take a little bit of time, and we have to be more familiar with that. So again, to have Norma focus on that and relieve me of that, or a variety of supervisors, it really does help, and to keep all that in line and monitor all that. At times, there is some limitations from online university programs that we all have to, again, follow up on, and again, make sure, because we don't want the student to fail. We don't want the student to be falling back. We want to make sure that we're responsible for their internship, and that they are in line with the requirements of the university. So again, sometimes again, lack of communication was felt. But this year, I think we felt it more than any other time. So I think that to me was the biggest thing. Currently, because we are a healthcare program here and part of a larger agency, there are some policies and limitations that impacted us in bringing on students from the outside. So again, we are compliant with what our requirements are here. So that, again, we at times have had to work with human resources and our quality department to make sure that we bring students on board safely, we orient them, and they fully understand, their role here during the time that they're being interns. But again, that's an ongoing process. Obviously, the students have a lot of requirements, and it does require at times, really 3 evaluations during their time they're here. So that's, again, I was so grateful for Norma for being able to, again, keep all that information. We want to be sure that we have those evaluations submitted to the various universities on time. So that's an ongoing process. Some students come with very limited experience. Some come with a wealth of experience. They have lived experiences. So we really have to tailor the placement and the internship to where they're at. So that's that's a work in process. We like to have a formal interview. We like to have an application. We want to get to know what the student's seeking, because if we cannot accommodate that, then again, it's not going to be a success. So the other challenge is that I think that we have a long ways to go in behavioral health to make sure that we promote this field at a younger age. We do have to do a lot more outreach. We do a lot of health fairs prior to this past year, but again, we got to be talking to our young people, introduce the field, make them aware of the various, again, types of disciplines, types of roles that they can have in behavioral health. And the more we can do that, the more likely we're going to have students choose behavioral health as a career path. So, thank you.
Okay, so if we can go to the next slide, I'll try to talk very fast. I think there's a couple minutes left.
So Norma and Mary, we've just got a couple minutes. If you wouldn't mind just wrapping up, we'd like to honor our time here. So
of course. So we'll end with the success. You know, these are the interns that gave us some of their feedback. And so we'll wrap it up as that. So as an agency, our biggest success has been the opportunity to have be part of the internship grant. And so some of the interns expressed, my internship experience helped me learn more about social work field and how to manage different stressors when working with clients. The experience also taught me areas where I needed to improve so that I can fine tune my skills and visually see my direction and career and objectives ahead. I learned about work ethics, communication skills, responsibilities, time management. I would also be able to put new things into practice. And then in my internship experience, I have learned constructive feedback. I am provided, I felt validated, felt heard and gained clarification, was able to adapt to clients' needs, have learned outpatient services. And this person expressed that where they worked, you know, they thought all of that was pretty similar, and they got to learn that there was differences in the different areas that we serve. The other student said, this far, I have really enjoyed my internship position working with as a behavioral health consultant here at Farm Workers, have learned valuable skills as working with diverse populations. Through this experience, you know, they have gained a lot of growth. And I think a lot of it, you know, expresses understanding more the field and working with the clients, a lot of learning about that and seeing where they're headed as professionals. So thank you.
all right. Well, thank you both so much for giving us experience of one of the larger organizations in the area of preventing behavioral health and substance abuse disorder treatment. So I think it's safe to say we've run the gamut of agencies or operations that are relatively small and outpatient based to those that are relatively large, and outpatient based to those that are relatively large and inpatient based. So I hope everybody, I think I speak for the staff by saying this has been a good overview of just what a little bit of funds can help provide to all of these good organizations throughout our 9-county area. I'm going to wrap up by a couple of things before we talk about the next meeting, which is September 16th. I want to see if Dan Ferguson, who heads up the GCACH Workforce Task Force or Committee, would like to add, if anything, Dan, putting you on the spot, for what we've heard, and then we'll go to Carol just to wrap up. So Dan?
Yeah.
Any concluding comments?
Yes, thanks, Patrick. And thank you all for presenting today. This has been something that I've been looking forward to and asking for as a representative of the board of directors and with the workforce committee. And having been a clinical supervisor for about 15 years in both Southern California and Washington State, I really appreciate just hearing all the diversity of programs and the benefit to our community, and just, again, really benefit. I have a whole list of bullet point kind of items that I'd like to just kind of reference. as we finish up, that I want to pay attention to, or I want our workforce committee and our board of directors to pay attention to as we benefit from the lessons learned from this. So I want us to really think about what we're doing to grow our own and retaining our own workforce that we're growing. I'm thinking about perhaps the necessity for preceptor or clinical supervisor training. I'm really interested in the relationships between our industry partners and our universities and colleges, and how we're adapting or evolving a curriculum. I'm really interested in how we're encouraging more team-based and interprofessional practice, particularly in the integrated care settings. Really love to hear more about the innovation work that's occurring. For example, the work at College Place High School. Just really love hearing about that. And I really like at the end there, or not so much at the end, but there's some focus on the value proposition or the return on investment and how that translates to actual dollars saved for our community. So I know that was a lot. I've written them down. I'll be bringing them up at our board meeting later.
Thank you, Dan. I know you won't let that matter drop. I'm knowing you. So keep it going, and I'm sure we'll want to circle back and have another discussion about these sorts of programs and their experiences down the road. With that, our meeting is coming to an end, but I always like to give the floor to our dynamic executive director, Carol, and see whether she has any concluding comments. And before I turn it over to her, I'll just point out that we will have a meeting in September, in a month, so the third Thursday at 9 o'clock. So put that on your calendar, please. You'll get a notice from us within the next 2 weeks about exactly what we'll be covering at that meeting, but I think you'll find it worth your while. So Carol, do you have any concluding comments?
I do, Patrick. For the sake of time, I think I'm going to keep it really short. We had no idea when we started this program the impact it would have on our community. I think the state has taken notice. They've actually come out with a House Bill 1504 that offers some funding for 3 ACHs to actually pilot this program. We're hoping that we are one of those. But because of the work that the committee did in implementing this program, I think that we've gotten the state's attention. So that's really, really lovely. I think all other announcements we will save for our community newsletter.
Okay, all right. So with that, folks, we are adjourned for another month. And thank you so much for staying the course and hearing everybody out. I think we all learned something and we can take back to our own jobs and organizations. And with that, I wish you clear blue skies. May the smoke disappear and may the rains come at least for a little bit over the next week or two, and have a good Labor Day.
Thank you.